This is a nutrition-focused physical exam, and this is Christine, my model. We're going to start out with vital signs. So for blood pressure, the cuff's going to go on right here. You'll want to sit up straight with your feet on the floor and be relaxed and just normal breathing. The cuff will go right here, and stethoscope will go here, and a normal blood pressure is 120/80. Your blood pressure was 116/80, which is in a good range. We just want it a little bit below 120/80. Anything above is high blood pressure, and if it's prolonged, and that's worrisome. A low blood pressure consistently could be your normal, but if it drops suddenly, that could be something to worry about too. Then for pulse, the location for that is on the inside of the wrist right here, or underneath the jaw under here. And that's counting the number of heartbeats per minute. Yours is 78, and a normal is between 50 and 100. The closer to 50 it is, it just means the more efficient your heart function is going. Sometimes athletes have lower pulse rates because they have more efficient heart function since they're working out a lot. And then for respiratory rate, that's measuring the number of breaths per minute. A normal is between 12 and 20. Yours is 16. Anything below 12 will be something to worry about, and anything above 25 could be like hyperventilating, too many breaths per minute. Okay. Next, we have the orofacial section. We're going to start with an extraoral screen looking at the muscles of mastication for chewing. First one's your masseters, which is on your jawbone, and then temporal up here. So when you're chewing and you clench your jaw, both those muscles are working in the clenching. And then the pterygoids, which is over here up on the side of the jaw, those are for lateral jaw movement. For TMJ, that's looking right here. So if you open up your jaw, my fingers go right into this part right here. We want a smooth range of motion there and no swelling or tenderness. Orbital fat pads, which I'm just going to put my hands right below your eyes if you want to close them. We're looking for the fat pads to bounce back under my fingers, and we don't want to feel the bone right there. That could show some muscle wasting or fat wasting underneath your eyes. Okay. So that'd be a sign of malnutrition as well as the rest of them if we have depressions. And then up here again with the temporal region, we're also looking there for malnutrition. So if there is depression and wasting and no bounce back on the pads, that would be a sign as well. So now for cranial nerves, your trigeminal nerve is right down here on your lower jaw. Facial nerve, I'll have you puff out your cheeks and smile and raise your eyebrows. And that's all those nerves controlling those movements. The glossopharyngeal nerve, open your mouth and say ah, and stick out your tongue. Perfect. And vagus nerve as well is also the same nerve that helps with that. The accessory nerve, I'll have you show your shoulders up and then move your head from side to side. Okay. And the hypoglossal nerve, stick out your tongue and then move it from side to side. Awesome. So those are nerves 5, 7, 9, 10, 11, and 12. Next we have a dysphagia screen. So we're checking your swallowing ability, and if you have any troubles swallowing foods, we're just going to do a dry swallow today. If you just want to swallow the spit, okay, no problems there. And then if you just want to cough, it's fine. Yeah, so that's just making sure that you have good, no abnormalities there. Then for the intraoral screen, I'm just going to put on some gloves. We're looking inside the mouth and inside on the lining of the cheeks. So first the buccal mucosa, that's the lining of the inside of your cheeks and the back of your lips where they touch the teeth. So if you just want to open up, we're just looking, making sure there's no redness or any swelling or bumps. The labial mucosa is the inside lining of the lips, so I'm just going to pull down your lip here and look, and everything's clear and fine, no redness. Any raised up bumps would be something to worry about, something to test for. And then floor of the mouth, I'm going to have you lift up your tongue with your mouth open. And that's on that floor of the mouth that I'm looking at for any abnormalities as well. And then your gingiva, I'm going to look at your gums if you want to open your mouth. And I'm just going to look up there. And all that's good too, no redness, no bumps, no swelling. And then if you want to lean your head back and open your mouth so I can look at your palate, the roof of your mouth, also good. And then just your tongue. So it's a smooth, normal color. There's no redness or swelling of like your taste buds or anything like that, so that's perfect. Okay, we're gonna move into skin and nails and muscle. Okay. So I'm gonna look at your fingernails first. So we want smooth nails. Any bumps along them could mean some nutrient deficiencies, which we could test for if needed. So I'm also feeling them just to make sure they're smooth. Another one for malnutrition, I'm going to look at your clavicle. So we want to push right here and behind and feel for the muscle. If this was a depression, if it was pushed in all the time, or if I could like reach around the clavicle, that could be a sign that you're having wasting there. And then around on your shoulder, this is the acromion bone region. We want this to be nice and rounded. If it was kind of pulled off and squared, that would mean that you have some muscle wasting here on your arms, and it'd be more bony, and we can see that. And then your upper arm region too. I'll have you lift up your arm and bend it like that. And we just leave it relaxed, and I'm just feeling for the skin under here. The thinner area skin there is, that would be a sign that you have some wasting. So I don't want to pull on the muscle, but I want to just make sure I'm grabbing on the skin. So that's good. And then I'm going to look at the back of your hand again. In between each of these bones, I could check for if there was any wasting, if it was like really deep, but we can feel the muscle in between each of these on the dorsal hand region. And then we'll do an assessment of your functional status of your hand. So I'm going to do a handshake, and it's nice and firm, so we know you have good functional strength. Then we're going to look at your quads. So right on the top of the quads, we're looking for any concaving. We want to make sure that the muscle is right here and there's no depreciation next to it. Even in an obese patient, you'd be able to see if there was concaved around the quadricep. We'd be able to check for muscle loss on there. And then we're going to look down at your patella. If it was popped out and very like wasting around the edges, you'd be able to see that. So yours is good. We don't have it really protruding at all. And then down in the lower leg as well, we want to look at your calf muscles for any thinness or any concaveness around for muscle loss. And then we're going to look at your feet. So we are looking for any edema in the ankle region or the feet. If there was any, it would be called pitting edema. There's on a scale from 1 to 4. The 4 is the worst, and that's the amount of centimeters that it's going in. So if I was pushing and the skin was staying down, that would be the pitting. Okay. And next, we're going to go into the pulmonary section. So we're going to look at your chest first of all. All right. So I'm going to look, and as you breathe, I'm going to watch your chest expansion. Okay. That looks normal. Feels good. Mm-hmm. Okay. And now I'm going to do tactile fremitus, which is assessing the vibrations of your lungs when you speak. So I'm going to have you say 99 as I do these. I'm going to use the sides of my hands, and I'm going to go down here and then down onto your abdomen, and then I'll do the same on your back. So each time I put my hands onto your chest, just say 99. 99, 99, 99, 99, 99. Perfect. So I'm able to feel the vibrations. If they were kind of diminished, that could mean there's air or fluid in your lungs. And if they're more increased, that could mean there's a decrease in, or increase in density or inflamed lung tissue. So I'm going to do the same on the back. If you want to just scooch up a little bit.
Do I say 99?
Yep.
99, 99, 99, 99.
Perfect. So we're able to see on both sides of the chest, so we can really see the lungs from there. Then we are going to move into the cardiac portion. So I'm going to look at your second right inner space. So that's on your right side, which is going to look like it's on the left for me.
Okay.
So that's right up here by your sternum. And then your left inner space is over here. And then left sternal border is down here, right by your sternum. And then the apex is below that. And then we are going to go into your abdominal region. If you want to lay down on the couch. We're looking at the 4 quadrants in your abdomen. So your right upper is up here. I'm just going to push a little bit. If there was some tenderness or swelling, this could mean swelling of your spleen or your liver. So we want to push a little deeper if we felt that and figure out what spot it's in and what we're looking at there. And then this is your right lower quadrant. This is kind of where your intestines are and your sigmoid colon. So if it was very full of stool or something, we'd be able to feel that. So if there is some tenderness in there, that could just mean that there's more stool in there. So every time I palpate, you want to exhale first, and then I'll palpate. Okay. So every time you do that. Okay, good. You can sit right back up. All right, so that's the end of our exam.
Okay.
All right, thank you.
Thank you.